Hi, I'm John Ray, founder of Haven Home Health and Hospice, and today I'm going to tell you a little bit about home health. This is very confusing for a lot of people because they don't know what home health really means. They think they might know, but there's some differences. So let me just break it down to most home health is when people go to the hospital or they've been in a nursing home or they've had some illness or accident, they'll call home health in because we have nurses, we have physical therapy, occupational therapy, speech therapy, and we have a social worker who will go in and really help that person manage that illness or that injury until they fully recover. And so we do a ton of different things in that environment. So there's wound care, we do wound vacs, we do extensive therapy for that individual if they have a decline. But the main goal is to get them independent in their home again. Usually these are acute situations and it's only for a short period of time, just up to a few weeks and even further in sometimes into a few months. We've even had some people as long as a year. Just depends on what their needs are, if it's fairly serious or not that serious. But home health is there for people who, if they're going home and they're concerned, it's difficult for them to get out to an outpatient clinic, for instance, or get out to see that doctor. Oftentimes they'll call home health in to make sure we can take care of all their needs while they're at home, and then they can transition to maybe an outpatient physical therapy clinic or going out to the doctor on a regular basis. But that time period when they first get home, they're kind of vulnerable, and so we want to make sure we're coming to them, and the frequency in which we come varies depending on the situation. But the biggest thing that we want people to know is that you don't necessarily, if you're not feeling well, you can have somebody come to you to take care of your needs.